Hello, everybody. My name is Fidelindo. I am a registered nurse. Currently, I am a full-time nursing faculty at New York University Myers College of Nursing. I was a staff nurse for about 19 years, mostly in the critical care settings here in New York City. The title of the article is Asians and Type 2 Diabetes Mellitus.
Fantastic. So could you briefly give an overview of why nurses should read your article?
So, Asian Americans are the fastest growing ethnic minority groups in the United States, and the prediction is this is just going to get larger and larger as a group. Currently, there are about 20 million Asian Americans living in the United States. So, the reason why I wrote this article is that there's science telling us that Asians develop diabetes with different patterns, and that article talks about how Asians develop diabetes about 4 to 10 years earlier than non-Hispanic whites. And so this is an interesting phenomenon. So I want the readers to learn the latest evidence that Asians develop diabetes at normal body weights or BMI that is considered normal. So in nursing, in medical school, in healthcare education, we learn the normal BMI is about 18.5 to 24.9. And anyone with a BMI of 25 or higher should be screened for diabetes. However, that is not true among Asians. So Asians develop diabetes at BMI of 23, which is actually considered normal. So that's the reason why I wanted to talk about this topic and share it among my fellow nurses and clinicians out there to be aware of the unique health patterns of Asians related to type 2 diabetes.
Wow, so with a very important topic, it seems. So what are 2 to 3 things that you would like nurses to take away from this article?
So what I'd like nurses and readers to take away from this article is to, one, increase our knowledge about these unique features of health disparities and health differences among different groups. And I am from the Philippines. I am Filipino American. I've been in the U.S. for about 33 years. So I have many family members who are diagnosed with diabetes and pre-diabetes. In fact, myself, I am also on the cusp of the pre-diabetes, and I have normal BMI. So what I want readers to get out of this is to learn about this information, apply it in their work, wherever they work. So if you are a nurse in the hospital, in a clinic, or anywhere where you interface with Asian Americans, to advocate for informing the patients that if they have a BMI of 23 or higher, they should have that conversation with their provider, which, screen for diabetes. And if they are discovered to have the risk, they should also, do something, hopefully, for health promotion. So the article speaks about medications that's used to treat type 2 diabetes. We know that diseases that has no cure, like diabetes, takes a long time to manage, or lifelong management. So you may have to take these medications for the rest of your life. Nurses are a good spot to educate the patient, to give them support, to build up their resiliency, to help cope with the condition, and have them self-manage their diabetes. When someone is well informed, you are better able to take care of yourself. So that's really what I'd like the readers to take out of this: to advocate for yourself, screen your patients when there's at risk, have those critical conversations with your patients who are Asian Americans who might have risk for type 2 diabetes.
That's great. Is there anything else that you would want the readers to know about your topic?
Yeah, I'd like the readers, the nurses, clinicians out there to continue to read on the topic. As you know, there's exponential rise of information, and science is always changing. So get familiar with the guidelines from the American Diabetes Association, from the U.S. Preventative Task Force for Health, and teach yourself along the way, because what is knowledge today may be outdated next year. And so we will always be continuously writing, learning, and sharing this information to our public. So I hope that I'll inspire the readers to learn more about this topic.
Awesome. Thank you so much for your time.
Thank you, Andrew, and have a good day.
Thank you. You too.